In this episode, we're going to be looking at the role acupuncture and dry needling can play in sporting populations. And my intention here is to give you an idea of how we could do this during play or very, very close to play, how we can use it in a prehab setting, and also how we can do this kind of like post-event. So I'm going to talk through those three different variables of how we may use acupuncture and dry needling and why. So let's kick off with the obvious one, which is injury management. Most elite professionals are having some kind of chronic problem that is just going on all the time. All right, so they've got a problem that they kind of just deal with and they push through because it's not bad enough to stop them from performing, but it's something which, you know, it kind of is in the back of their mind. And it's interesting when you look at the psychology, in particular like elite sport, where if a team is performing well, that players can seem to push through that and it doesn't bother them as much. But then when the team isn't performing well, those kind of things seem to come to a head and really stop them from being able to perform. But in chronic scenarios, it doesn't really matter whether they're an elite performer or not, right? We've got a really good evidence base to support that acupuncture does have a positive influence on persistent and chronic pain. In this kind of like prehab world, if we're talking about that, I'm thinking that to help manage the symptoms of a chronic problem, and when I'm talking about symptoms, I'm talking about the pain intensity, I'm maybe talking about the ability for the muscle to contract, I'm talking about how worried people are about it. We can just do it like we would do in, say, a normal clinic that you would get somebody with a chronic problem in. And that is to say that we're really going to be thinking about points that are in and around and local to the area of the problem. And we're also going to be looking at distal points. Now, there's a couple of reasons for this. The distal points, i.e. the points that are in our hands and wrists and our ankles and feet, they're the ones that seem to do all of the psychosocial stuff. So if you look at any of the textbooks, you'll be able to see that, you know, I've got a big orange textbook over there, right? So there's a massive orange textbook over there. It's like that thick. It's got like some points of like, there's like 4 or 5 pages dedicated as to what these points do. And these points are almost always situated at your wrist and hand and ankle and feet. From a Western perspective, that's where we've got all of our innovation. So these are the super sensitive areas. It kind of makes sense that if the super sensitive areas, they're going to be registering stimuli in the brain a lot more. And that's kind of like the crude theory as to, from a Western perspective, why we'd want to put distal points in. Because what we're doing when we put the distal point in is that we're getting big messages to the brain. And so we're more likely to hit those areas of the brain that are about interpretation and about emotion, so things like the limbic system. So honestly, obviously with chronic pain, we know that chronic and persistent pain have big drivers related to the psychosocial elements. So we kind of want to see if we want to deal with that. That is the big reason for why we want to do distal points in an athlete who has got a chronic problem, because we actually want to try and calm things down. We want to not have the concern and the worry, and we certainly don't want the over focus on this issue. The reason why we do points local to the area of the problem is there is an element of local tissue response, which we'll talk about with acute injuries, but it's more about the individual perceiving as that being the area of the problem. So if I'm just kind of give you a scenario here where imagine you've got a bad back, right? Or you've got a bad knee, whatever. I use knees as an example all the time, right? And we think that the predominant driver here for their painful knee, their chronic painful knee, is more of a psychosocial stuff. So there's more areas in the limbic system that are kind of going, you know what, this is something I'm really worried about and I don't really want you to do anything with it, blah, 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 blah. You're thinking, well, we want to do the psychosocial points. And Carl, you've just told us that the big psychosocial points are wrists and hands and ankle and feet. It's all well and good. But the brain is all about interpretation and understanding the world around it. So if you came into my clinic and all I did were points in your ankle and feet and your wrist and hands, you'd be like, he does know that my problem's in the knee, right? And that's a conscious thought, but even the subconscious and the unconscious brain is going, yeah, well, I know that the problem's at the knee, even though it's a bit about interpretation, right? I know that the problem's at the knee and there is no treatment being delivered to it. So one of my reasons why, even with a chronic problem, I'm still putting needles local to the area of the problem is that not necessarily because I'm thinking I'm trying to do some tissue changes or physiological getting like substance P, CGRP to be aware, whatever. I'm doing it because that kind of confirms, but yeah, that's my problem area, and you are doing something to it. So with your elite athletes in this scenario, you're thinking about chronic pain and persistent problems, and that can be a way to manage it, just like you would do with anybody else. What I would say, and I should have said this right at the start actually, is about when you needle athletes. So when you're needling athletes, can have a big impact on performance. So if I've never needled an athlete before, and if this athlete has never been needled before, and there's no kind of risk to performance, I'm not going to do the needling very close to that. So say within the first 48 to 72 hours, I'm probably not going to introduce needling for the first time, because we don't know how people are going to react to needling. And there will be some people who react and they get really tired and chill and just like, do you know what? This is fine, man. I'm just super cool. And this can last like a couple of days. That's the last thing you want, right? If you're going to a competitive environment, you need to be like aggressive. You need to be on it, right? You need to be like, grr, I'm a tiger. I'm Tony the Tiger, right? You do want to be chill, right? And certainly in the certain sports, like you definitely don't want to be that. You're going to get hurt. So what you want to be able to do, you don't want that reaction. And if you've never needled this athlete before, or this athlete's never been needled before, you could inadvertently have a negative impact on their performance if you do it too close to the performance. I mean, I'm thinking like if you're doing it like 4 or 5 days beforehand, you're going to have a washout. So you shouldn't still have that kind of like chill out mentality. It can work the other way, by the way. So you do get some people who get super energized from acupuncture dry needling. So I do know of elite athletes who get this done really close, like maybe it's like 20 minutes before they go out on the court or the pitch, because it helps to energize them and it like really gets them awake and ready to go. But if you've never done it before with somebody, you don't do that just before the performance, all right? Because you don't know how they're going to react. The only caveat to that I'm going to say is that when people... if it's the difference between them being able to perform or not. So I remember years and years and years ago, I had a semi-professional athlete who they weren't going to be able to play. They were I used to work at a football club, so they'd be like, it was the starting left back, needed to play, right? It was a big game for the club. Was like, I'm not really feeling this. And a lot of his game was based on pace. So being able to like speed, getting up and down the flank. And it was like, look, I can be a body, but I don't feel like I can do this. And kind of looked at it and was like, right, well, this is the difference between him playing and not playing. And so there was going to be, if it didn't work and he felt chill, whatever, it didn't matter because he wasn't going to be able to play it anyway. So we needled him. And actually, he played really, really well. He went on and scored 2 goals. I got 0 credit for that, by the way. So I'm looking at you, and you know who you are. I got 0 credit for that. Yeah. But the point being is, in that scenario, there was no risk, right? So if we did the needling and he was no better, then he was never going to be playing anyway. If we did needle him, which we did do, and then he was able to go and play, well, great. He was able to go out there and perform. So I think that's like thinking about when we needle an elite athlete is really important. The next point in that, which I think is about that kind of like thinking about the individual athlete, is, asking about how they've responded to acupuncture dry needling, if they've had it in the past, what do they understand about it? What do they understand about its benefits and its limitations, and the theoretical component to it? I've talked about this on previous podcasts about, what do people buy into? And there are some athletes out there who really buy into more of that kind of like general wellness and traditional Chinese medicine perspective of things. And that's how I'm going to describe it to them. I'm not going to describe it to them in a Western perspective, because that's a turn off for them. They're not going to listen to you. They're not going to buy into you as the practitioner. And vice versa. If they are a lot more tuned into like Western physiology, then I'm going to talk to them about Western physiology. And it really, any years that work in sport will be able to confirm this. But, a lot about in working with athletes is about, getting them on board and forming a bond in a relationship where they can trust you. Okay. And I think that how you describe the actions of acupuncture and dry needling can contribute to that relationship and them having that trust in you. So having the flexibility to move between traditional Chinese medicine descriptions and Western physiology descriptions is really helpful, because it means that you can form bonds with people regardless of how they see the world and how they see their body. All right, so going back to how we deal with injury management. So talking about chronic pain and chronic issues. When it comes to acute injuries, this is kind of roughly how I'm looking at this, right? If this is a normal response, let's say it's like an ATFL tear, like grade 1 ATFL tear, the amount of pain that they've got is what you'd expect, the amount of swelling that they've got is what you'd expect. I'm probably not thinking about acupuncture dry needling, right? It's doing what it should do. It's giving you enough swelling and enough pain to say, look, hey, we're not super ready yet to go and put this properly stressed. So that pain and swelling is there for a reason. We want it there, and that's actually acting as a really good barrier to stop you doing too much to it. So I'm not going to get involved in that, right? I'm not thinking about acupuncture and dry needling, because theoretically what we could do is reduce the inflammation from the area. We could reduce the amount of pain intensity, which could falsely lead to the player thinking, hey, do you know what? I'm feeling loads better, and then potentially causing a much worse injury, so like tearing the area a lot more. I mean, we're talking very much in the theoretical realm here, but we know that acupuncture works as an anti-inflammatory and it works as a pain reliever. Pain and swelling is there for a reason, particularly in the very early stages of an acute injury. If it seems to be reasonable, if it's a reasonable response to the injury that's there, I'm not thinking about doing needling, because I want the pain there and I want the swelling there. However, if that, you've done your scan, or you've done your diagnosis and you're pretty confident it's a grade 1 ATFL tear, yet there's a load of swelling there and there seems to be a disproportionate amount of pain, then yes, I'm going to start looking at acupuncture and dry needling, because we're not looking to get rid of the pain and swelling, but we're going to try to attenuate it. We're going to try and calm it down. For example, in the lateral ankle, you could be looking at points like, say, like the bladder and the gallbladder and the stomach. They would be your predominant meridians and acupuncture points that kind of sit in and around the lateral aspect of the ankle. We're not going to put needles in the active inflammatory area. We're going to go in and around the area. That's how I would deal with that. So if I'm thinking, look, this looks like it's a bit of an overreaction. The body's gone into overdrive here, and it's a bit too much pain and a bit too much swelling. We know that can hinder people's return to play. So I'm going to pare it back a bit and say, right, do you know what? Let's do some needling just to try and calm that down a little bit. That is where something like Surround the Dragon comes in lovely. So Surround the Dragon, if you've never done Surround the Dragon, right? So imagine this is our circumference of the area of swelling and pain. So just for argument's sake, let's imagine that everything in here is where the pain is, and this edge of the cup here is where the boundary of the pain is. Surround the Dragon is literally putting needles around that boundary, so as close as you can to get to the painful area, but you're not in the painful area. You get as close to it as you can. If it was something like the circumference of that cup, maybe I'm going like northeast, south, and west. So maybe I'm doing that. Maybe I'm going to go with a few more. So I might do 4 needles. If it was that size, I maybe be inclined to do another couple around the area. But Surround the Dragon isn't using acupuncture points. It's putting needles around the boundary of an area that's got pain and swelling, as opposed to specific acupuncture points. I've hammered it home a lot of times, if you've done courses with me particularly, but certainly if you've listened to previous podcasts, about you get the most benefit from needling acupuncture points, and that doesn't change. But often what you get in an acute injury is that there's not a lot of acupuncture around that area. So you're still going to have a physiological response. You just wouldn't have as big a physiological response as if you're putting a needle into an acupuncture point. But Surround the Dragon's a nice way to kind of try to localize an anti-inflammatory response to that area, which should hopefully create some pain relief. I'm also thinking of this as kind of like parting our rehab scenario. And when I'm thinking about acupuncture dry needling in a rehab scenario, if I go back to my first example where this is behaving as I would expect it to, I'm not thinking about acupuncture dry needling. So let's say it's like hamstring tear 4 weeks down the line. It's progressing as I would expect it to do. I'm gradually increasing the load. My exercise and my rehab is going as it should, and it's hitting the milestones as I would expect. I'm not thinking about acupuncture dry needling, right? That's the thing that's going to get somebody better. And as I've said countless times, we're thinking of acupuncture and dry needling as an enabler. So in a scenario where it's progressing as it should, you don't need acupuncture and dry needling. Okay, if they've still got a little bit of discomfort, but it's what you'd expect, good. It should be there, right? We want to try and put the brakes on somebody to get coming back too soon. However, in a scenario, let's say 4 weeks down the line, and it's been a hamstring tear, and it's still really uncomfortable, and that pain is the thing that's inhibiting someone from pushing themselves on a little bit further. Tendinopathy, I know that's slightly different, quite a bit different to a tear, but it's a good example of that. It's like it's not that the capability of the muscle belly and the tendons not able to do it. It's the fact that of the pain that's stopping somebody from doing it. I'd be inclined to use acupuncture dry needling in those scenarios. So in my hamstring, I could use like a bladder 36, bladder 37, bladder 38. I could use some distal points on, say, like bladder 60, for example. And what I'm effectively doing here is I'm trying to reduce the pain intensity. I'm trying to reduce the amount of inflammation in the area, which is likely causing the pain. So reducing that irritability and the sensitivity to it. And if they've got reduced pain and reduced swelling around the area, they're more likely to be able to get a bigger muscle contraction. They're more likely to be able to tolerate more, whatever it is you're doing your rehab. And therefore, they're more likely to be able to get over that hump and progress on as you expect. In my rehab setting, that's where I'm thinking acupuncture and dry needling comes in lovely. I guess the final bit when I'm thinking about where I've used probably more dry needling techniques, if I'm honest, is where if you've got like set protocols, like say like an ACL rehab is a really good example of this, where surgeons would say, I'd expect you to be at this point in 2 weeks and this point in 4 weeks and this point in 6 weeks. And people aren't getting to that milestone, and they need to be able to reach that milestone before you can move them on to the next phase of rehab. What I'm doing there is I'm thinking specifically with dry needling is if it's a range of movement thing, I'm looking for trigger points in the muscle bellies and I'm dry needling those muscle bellies. If I was going to give a daft example, right? So like say somebody's had like a shoulder repair, right? And we need them to get at, let's say, a full range flexion of the shoulder before we can progress on to X exercise or Y contact. Let's say it's a rugby player, right? So they can't get there. What I'm thinking I'm going to be doing here is I could do some dry needling techniques, which remember are really quick, 15, 20 seconds, right? Looking at the muscle bellies around the area. So like your lats, your teres major, teres minor, whatever it is, right? So do a lot of dry needling techniques. So now they can get from here to here. They now can get to that end range. And now what I can do is do me rehab in that range, okay? And it might be I never need to do dry needling ever again, right? It might be that one approach, that one time is needed just to be able to get them to that end of range. And now what's going to help them maintain that end of range is the other stuff that you're doing in rehab. For me, that's kind of where the dry needling sits lovely in the rehab setting of an athlete, because you're able to get them and push them to an end of range, which then they can then train it, if it's a strengthening or a power or whatever it is that you're going to be doing with them. Okay, so that's rehab, and I think that's where its role is, acupuncture, dry needling. When we're talking about prehab, we've got some interesting takes on this, right? So if we're kind of taking injury aside, we've got a couple of things we can do here. We have got endurance activities. So stomach 36 in particular, from a traditional Chinese medicine perspective, is quoted for endurance activity. So if we were to go purely down a traditional Chinese medicine route of trying to increase somebody's capacity for endurance work, we can maybe use stomach 36 as part of their training regime. So if we're looking at, say, like a middle distance competitor, somebody who's doing a lot of endurance work, what you may include as part of their training package is using stomach 36, and you would needle it bilaterally, and you would see to hopefully help increase their endurance capacity. When you watch the Olympics, and I use the Olympics as a really good example of this because you've obviously got lots and lots of athletes from all over the world, you will see loads of the top performers having something in and around stomach 36. So you'll see them where they're obviously not going to have a needle, middle distance runners not going to have like a needle in stomach 36. And for those of you that don't know where stomach 36 is, that's in tibialis anterior. So it's in your shin, right? You're not going to have a needle stuck in it, but you'll see people have like certain tapes and straps over that area. And it's trying to give some acupressure to stomach 36. So when they're actually performing, they're trying to stimulate stomach 36. But what I'm suggesting is part of prehab, so the lead up to a competition, you could do some needling around stomach 36 to try and increase their endurance capacity. What I'm doing here as a caveat here, there are no randomized control trials here to prove that this works. This is very much, there could be a big psychological thing, and it doesn't really matter if you put it in stomach 36 or in your nose or your shoulder. We don't know that, but I would say that, that I know of a good few athletes who do use stomach 36, and they say that, hey, this makes a big difference. And It's not causing any harm. It's certainly not causing any adverse events or adverse impact to their performance. There's no reason why something really simple like stomach 36 couldn't be included. The other part, which is really a lot more prominent these days, and certainly in elite performance, is about the balance between training and then your downtime. So there's a couple of techniques you can do to try and encourage more the parasympathetic type activities. You got 4 gates, which we talk about almost all the time. So large intestine 4, liver 3 bilaterally. That's a really good calming thing. So if somebody's working at high intensity and the coaches are wanting them to get a really good night's sleep, they want them to get that rest period in. After a really, really high intense workout or session, what you can do to try and help encourage the relaxation and chill is do something like 4 gates. So you can do 4 gates really quickly to calm people right down. The idea is that you're trying to speed up the recovery or them getting into recovery mode. The other thing you could do is something called the back shoe points. So it's a series of needling that you can do over the thorax and upper lumbar spine. There's a traditional Chinese medicine reason to this, because you're stimulating all the yin organs, and your yin organs are all the kind of your general health and well-being. From a Western perspective, it's thought that that's where your sympathetic nervous system sits, between T1 and L2. And if we're needling over that area, we can try to calm it all down. Definitely as a technique of trying to just chill people out, you could do the back shoe points, or you've got the ear. So you've got the NADA protocol. Needling the ear is thought to stimulate the auricular nerve, which stimulates the vagus nerve, which then goes and stimulates the parasympathetic nervous system. If we're talking about prehab and we're talking about performance, what we can actually do with our needling, either through 4 gates, back shoe points, or the ear, is to just encourage people to get into relaxation mode a lot quicker. Very similar to post-performance, okay? So that was the prehab, the post-hab or post-performance. What we're effectively doing here is we're trying to get people to calm down as quick as possible. So normally after an event, so that might be a game, it could be a race or whatever, they want to be competing at a super high, right? They want to be really, really on a massive high, and they need to come down, all right? And that's where I'll do those 3 things again. 4 gates, back shoe points, ear, to try and bring people down. If you're looking at something where people are competing every day, so like say professional golfers, tennis players, things where people they're not just doing a one-off and then they've got a week break. They probably want to get into that chill zone really, really quickly. That could be a lovely way of doing it, right? Because you're going to really encourage the chill out time and the relaxation stuff a lot quicker by doing those things. The final thing is thinking about how do you do this in-game. I kind of give some clues here about what you'll see about endurance athletes doing. So endurance athletes will often use some kind of tape or acupressure thing to use during an endurance activity over stomach 36. But there are other ones that you can do. So you can do heart 7, for example. So you might see that people either have something on heart 7 here, just next to pisiform, like an acupressure plaster. They might have something here at yin tang. Although I've got to be honest, I don't see that happening so often. You might see something in the ear over shen men. So the shen men in the ear is supposed to be related to heart 7. Now, those 3 points are about focus and clarity of thought. So where the athlete is about focus and clarity of thought. Let's say it's something like darts, or we know that there were the biathlon, where there's case studies where people were using acupressure points during the performance. So the biathlons where they do the really aggressive skiing, and then they have to shoot at a target. So they have to go very quickly from a gross motor power activity to a very steady, controlled environment. Using acupressure can help an athlete get into that zone very quickly. So acupressure on yin tang here, acupressure at heart 7 here, just below pisiform, or acupressure here over shen men. Those are 3 options, which could be like a plaster, an acupressure plaster to keep them in that zone, or it could be something that you teach them to do through just digital pressure through the thumb on those areas to try and get them to quickly get into super focus. So these will be some options for during performance. The other things that you can see, again, where I'm thinking about where people can have breaks. So I'm going to use tennis as an example. You can see it in basketball and things where people have regular breaks, you may be helping to just maintain them beyond the court. So you could do something like your dry needling techniques. You're not thinking about acupuncture here in terms of 25, 30 minutes. You're not thinking about your distal points. You're thinking about literally needling the tissue that seems to be bothering them. I'll do the stereotypical tennis elbow, right? I don't think I've seen anybody who's a tennis player, but anybody that has tennis elbow, I don't think any of them played tennis, but there you are. So you might be that you've got a tennis player and they've got a lot of tenderness around there. They feel like the backhand's not working as well or the grip's being reduced. You could do some really quick dry needling techniques to allow them to get back onto the court really quickly. So that's kind of what I'll be thinking of as like in-game techniques. Kind of slightly separate but appropriate as around concussion. So we have a really prominent acupuncture point around the wrist called pericardium 6. And it's used for nausea and vomiting. And so one of the signs and symptoms of concussion is nausea and vomiting. So you can do that yourself. You wouldn't necessarily needle it, but you would do acupressure over pericardium 6. You could teach the individual to do it themselves, but you can do that bilaterally over pericardium 6. Firm acupressure on that area to try and prevent them feeling from being sick or prevent them from feeling nauseous. That would be it for me. There's obviously more in-depth physiology. There's a lot of acupuncture points we could use. In traditional Chinese medicine, there is actually some acupuncture points you can use for acute injuries, and they're called the Xi cleft points. So that's XI, then cleft. And the Xi cleft points are for acute problems of the meridian. So I forgot to mention that actually when I was talking about acute injuries. So look for Xi cleft points. If you're dealing with acute problems, you would needle Xi cleft points. So that's basically acupuncture points on the meridian that are supposed to deal with acute problems. So there you go, a nice little tip that I nearly forgot to tell you about. In summary, we can use acupuncture for a whole myriad of problems. We know that lots and lots of elite athletes use acupuncture and dry needling in almost every single sport with great effect. Some of them are using it in prehab settings, so they're using it in a way to like try and improve performance. So they're doing it like to increase endurance, or they're trying to do it to increase the speed in which they can go into the chill relax zone. We can do it post-performance. Again, the idea being that we can get people up from their high very quickly down to a low so they can get into their rest and repair phase. We can do it during performance as well with some things like dry needling techniques and acupressure techniques. And then obviously we've got the injury management stuff as well, which is all about enabling the athlete to perform, but enabling us to do the other stuff, which is going to help in their rehab program. I hope that's been helpful. As always, as I say at the end of every single podcast, please like, comment, and share. The more people that view this podcast, the more popular it'll get. And obviously we know we're doing something right. The more that you provide us with comments and some feedback, the more helpful that is. So we know that we're doing something that is helpful to you. That's why we're doing it. Hope you've enjoyed it. I'll see you on the next pod.